All set? Let's get started.
Which of the following blood groups has been shown to be sex-linked? The correct answer is C. Which of the following blood groups are produced by the tissues and adsorbed onto the surface of red blood cells? The correct answer is C. Lewis. What protein determines the Colton blood group? The correct answer is A. Aquaporin 1. What is the term in which an antibody is inactivated by reacting it with an antigen against which it is directed? The correct answer is D. Neutralization. Which of the following is an antibody that is usually considered as an autoantibody and detected in the serum of an adult? The correct answer is B. Anti-I. Which chemical can completely eliminate all Cal blood group cysteine antigens? The correct answer is A. Dithiothiol. Which of the following antibodies is classified as biphasic and an autoantibody? The correct answer is C. Anti-P. What trait can be found in individuals who belong in this blood group? The correct answer is A. Resistance to malaria. Which of the following methods is the most effective way to remove anti-P1 antibodies from a mixture of antibodies? The correct answer is B. Neutralization with hyatid cyst fluid. How many hours should Rhogam be administered after delivery? The correct answer is C. Within 72 hours. Which of the antigens below is considered low incidence? The correct answer is D. Which of the antigens below is considered high incidence? The correct answer is B. In the Rh system, this genotype represents. The correct answer is A. Rh null. What is the term used for the removal of unwanted antibodies? The correct answer is B. Adsorption. Which of the following tests detects in vitro sensitization of RBCs with IgG or complement components? The correct answer is B. Indirect antiglobulin test. Which of the following causes false positive results in anti-human globulin testing? The correct answer is D. All of the above. Which of the following samples should be used in performing the direct antiglobulin test? The correct answer is A. Whole blood and ED2. Polyspecific anti-human globulin reagent contains. The correct answer is C. Anti-IgG and anti-C3d. This compatibility testing is used when the recipient has no history of alloantibodies and the current antibody screen is negative. The correct answer is A. Immediate spin cross-match. What term is used to describe the process of an individual donating blood for their own use in anticipated medical procedures? The correct answer is B. Autologous donation. Leukapheresis should be done no more than. The correct answer is A. Twice a week, or 24 times a year. What is the standard anticoagulant preservative volume in a blood bag for a 450 milliliters collections? The correct answer is A. 63 milliliters. What is the standard anticoagulant preservative volume in a blood bag for a 500 milliliters collection? The correct answer is B. 70 milliliters. What is the most common electrolyte abnormality associated with massive transfusion? The correct answer is B. Hypocalcemia. What is the substrate used for RBC to maximize ATP synthesis? The correct answer is D. Adenine. What is the minimum platelet count required for a donor to be eligible for plateletpheresis? The correct answer is C. How long must a recipient sample be kept in the blood bank following compatibility testing? The correct answer is C. 7 days. Which of the following conditions is most likely to result in a permanent deferral from blood donation? The correct answer is B. History of positive HIV test. Which blood component is given to patients with acute blood loss and active bleeding to increase blood volume and RBC mass? The correct answer is A. Whole blood. What blood component is typically transfused to increase the red blood cell mass in normovolemic patients with anemia or significant blood loss? The correct answer is B. Packed RBC.
That's a wrap. Tally up your scores and let me know how you did. Make sure to like, subscribe, and hit the notification bell so you never miss another quiz video.